Tenoretic 100 is a medication used to treat high blood pressure, also known as hypertension. This helps to prevent strokes, heart attacks, and kidney problems. It contains two medications, Atenolol and Chlorthalidone. Atenolol is a beta blocker that lowers the heart rate, blood pressure, and strain on the heart by blocking certain natural chemicals in the body. Chlorthalidone is a diuretic, also known as a water pill, that helps the body get rid of extra salt and water, as well as relaxing the blood vessels to help improve blood flow. These medications are used together when one drug alone is not controlling your blood pressure. Your doctor may start you on individual medications first before switching you to this combination product if it is the best dose for you. Remember to take Tenoretic 100 by mouth once daily, with or without food, as directed by your doctor. Try to take it at least 4 hours before bedtime to avoid having to wake up to urinate. It's important to use this medication regularly at the same time each day to get the most benefit from it. Avoid drinking apple or orange juice within 4 hours of taking this medication, unless your doctor or pharmacist tells you otherwise, as it may prevent your body from fully absorbing atenolol. The dosage of Tenoretic 100 is based on your medical condition and response to treatment. If you also take certain drugs to lower your cholesterol, make sure to take Tenoretic 100 at least 2 hours before or at least 4 hours after these medications. It may take several weeks before you get the full benefit of this medication, so keep taking it even if you feel well. And don't forget to tell your doctor if your condition does not improve or if it worsens. Some common side effects of Tenoretic 100 may include dizziness, lightheadedness, tiredness, nausea, and diarrhea. To reduce the risk of dizziness and lightheadedness, it's recommended to get up slowly when rising from a sitting or lying position. This medication may also reduce blood flow to your hands and feet, causing them to feel cold. Smoking may worsen this effect, so it's best to dress warmly and avoid tobacco use. If you experience symptoms of dehydration or electrolyte imbalance, such as extreme thirst, very dry mouth, muscle cramps, weakness, fast/irregular heartbeat, or confusion, it's important to tell your doctor right away as the chlorthalidone in this product may cause these effects. Serious side effects that should be reported to your doctor immediately include very slow heartbeat, fainting, trouble breathing, signs of kidney problems, toe/joint pain, mental/mood changes, blue fingers/toes, new or worsening symptoms of heart failure, decrease in vision, eye pain, or symptoms of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects not listed, it's best to contact your doctor or pharmacist. Always consult your doctor for medical advice about side effects and any concerns you may have about taking Tenoretic 100. It's important to not stop taking Tenoretic 100 without consulting your doctor, as suddenly stopping the medication can worsen certain conditions. Some people who have suddenly stopped taking similar drugs have experienced chest pain, heart attack, and irregular heartbeat. If your doctor decides that you should stop using this medication, they may direct you to gradually decrease your dose over 1 to 2 weeks. When gradually stopping Tenoretic 100, it is recommended to temporarily limit physical activity to decrease strain on the heart. If you experience chest pain/tightness/pressure, chest pain spreading to the jaw/neck/arm, unusual sweating, trouble breathing, or fast/irregular heartbeat, seek medical help right away. Remember to take Tenoretic 100 exactly as prescribed by your doctor. The usual recommended dose is 1 tablet once a day. It's best to take it at the same time each day to help you remember. If you have any questions about the best time to take this medication, be sure to ask your doctor. Before taking Tenoretic 100, inform your doctor or pharmacist if you have any allergies to atenolol or chlorthalidone, or if you have a history of liver or kidney disease, heart rhythm problems, gout, lupus, breathing problems, blood circulation issues, mineral imbalances, allergic reactions, muscle/nerve disease, or if you are pregnant or planning to become pregnant. It's important to discuss your medical history to ensure the safe use of this medication. This medication may make you dizzy, so it's important to avoid alcohol or marijuana, which can increase this effect. It's also advised to avoid driving or operating machinery until you know how this medication affects you. If you experience excessive sweating, diarrhea, or vomiting, make sure to stay hydrated and report these symptoms to your doctor. Additionally, Inform your doctor about all the medications and herbal products you are using before undergoing any surgery. Tenoretic 100 may reduce the potassium levels in your blood, so your doctor may recommend adding potassium to your diet or prescribe a supplement. It can also prevent the fast or pounding heartbeat associated with low blood sugar levels, so it's important to monitor your blood sugar levels regularly if you have diabetes. This medication may also make you more sensitive to sunlight, so it's important to limit sun exposure, use sunscreen, and wear protective clothing. It's important to note that older adults may be more sensitive to the side effects of this medication, especially dizziness. If you are pregnant or breastfeeding, it's crucial to discuss the risks and benefits of using Tenoretic 100 with your doctor. It's important to be aware of potential interactions with other medications when taking Tenoretic 100. Certain drugs can affect how Tenoretic 100 works or increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Tenoretic 100 include dofetilide, fingolimod, and lithium. Additionally, there are some products that contain ingredients that could raise your heart rate or blood pressure. Be sure to inform your pharmacist about all the products you are using and ask how to use them safely, especially cough and cold products, diet aids, or NSAIDs such as ibuprofen or naproxen. It's also important to note that Tenoretic 100 may interfere with certain lab tests, potentially causing false results. Make sure that the lab personnel and all your doctors are aware that you are using this medication. If you or someone else has taken too much Tenoretic 100 and is experiencing severe symptoms such as fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call the local Poison Control Center at 1-800-222-1222, or in Canada, call a provincial poison control center. Symptoms of an overdose may include severe dizziness, fainting, very slow heartbeat, and trouble breathing. It's important to get help right away if you notice any of these symptoms. It's important not to share Tenoretic 100 with others. To help Tenoretic 100 work better, consider making lifestyle changes such as participating in stress reduction programs, getting regular exercise, and making dietary changes. You should talk to your doctor or pharmacist about lifestyle changes that might benefit you. While taking Tenoretic 100, it's important to have lab and/or medical tests done, including tests for kidney function and blood mineral levels like potassium. Make sure to keep all medical and lab appointments, and consult your doctor for more details. Additionally, it's important to have your blood pressure and heart rate checked regularly while taking Tenoretic 100. You can also learn how to check your own blood pressure and heart rate at home, and share the results with your doctor. If you forget to take a dose of Tenoretic 100, you should take it as soon as you remember. However, if it's almost time for your next dose, then you should just skip the missed dose and take the next one at your regular scheduled time. It's important not to take a double dose to make up for the missed one. When it comes to storing Tenoretic 100, it's important to keep it at room temperature, away from light and moisture. Make sure to store it in a place that's not in the bathroom, and always keep it out of reach of children and pets. When you no longer need Tenoretic 100 or it reaches its expiration date, it's crucial to dispose of it properly. Instead of flushing it down the toilet or pouring it into a drain, consult your pharmacist or local waste disposal company for the best way to discard it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.